much. Let me,
Oh, my pleasure, my pleasure. All right, we are
put this on
live,
my
everyone.
display.
Happy Saturday. Happy Saturday. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Medical Family Medical Center. Oh my gosh. In this awesome city of Mansfield, Texas, not too far from Dallas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. Please, if you're watching live, hashtag live. And if you're watching replay, hashtag replay. If you could tell me where you're watching from, that'd be awesome too, so I could see who's following us and all that good stuff. But I'm delighted and excited to have with us today Dr. Grace Esan. I hope I pronounced that right. How are you, Doc?
Yeah,
I did? Okay,
I am
awesome,
well,
awesome.
thank you. Thank you so much for
I,
having me on.
my pleasure. And today we were talking about the topic, Doc, how do I help my kid with ADHD to thrive? Now, for those who are watching, you could always comment live, and you could tag your friends as well in the comment section, to have them join us live. So that would be very helpful as well. Now, that being said, Doc, could you kindly introduce yourself? Who are you and what do you do?
I am Grace. I'm Dr. Grace Esan, and I am a board certified pediatrician. Um, I've been a pediatrician for the past 20 plus years, and I take care of kids from 0 to 18, sometimes all the way up to 21 if they're in college. And um, I take care of their growth development, take care of their illnesses. And my big focus is actually on ADHD. And the reason why I'm interested in ADHD and its related disorders such as anxiety, depression, oppositional defiance, and all those other things that go along with ADHD. And the reason why is that when I went to medical school, there was little or no mention of ADHD, and found out that a whole bunch of people struggle, myself inclusive, without recognizing what exactly the problem was, or why my brain works the way it worked. And so I recognize the fact that kids are still struggling with it today. And so my thing is to help parents navigate it, help moms and dads navigate, and also help the kids thrive with their ADHD diagnosis.
Awesome, awesome. So you already answered this my next question, which would be why. And so you have a personal experience and you realize that this is something that needs more attention and more options for those who are, who are struggling with it and for your niche. So that's awesome. I love what you do, Doc. So glad to have you on. Now, my next question to you is this. Let's talk lifestyle. I'm a big fan of lifestyle changes, but what would you say first before we do that? What is ADHD, in simple terms for our viewers? What is ADHD?
So, in simple terms, ADHD is essentially this disorder that affects attention, and impulsivity. Actually, okay, so let me backtrack and start like this. It's the definition of it is attention deficit hyperactivity disorder. And in this disorder, the kids and adults actually suffer from the inability to maintain sustained attention to tasks, sustained focus. They can be hyperactive. In children, they're running back and forth. In the adults, it's in the thoughts that they're thinking. And they could also be extremely impulsive. So in the kids, because they're impulsive, they're always getting into trouble because they can't sit still, because they're running back and forth, and this essentially disrupting the environment. And for adults, it is this impulsive either spending, impulsive conversations, communication without thinking that actually affects relationships and
Mm,
even the workspace. So that's what ADHD is in a nutshell. So it affects not just the academics for little kids, it also really, really affects their social interactions, as well as affects how they communicate and interact with their families. And the same thing for adults. It affects them at the workplace, it affects them in their interpersonal relationships with their spouses and even with their children, and especially with their children. So that's why it's such a big thing. And it's really, really important that it's recognized. Now, unfortunately, there's also a stigma attached to this. And so it is really important that one understands that this is something that is very easily treated. And so it should not actually be stigmatized.
So something that can be treated, something that affects people's quality of life much more than they know, including kids. It's not just a school issue or a work issue. It's a relationship issue. It's a life issue. And so it's important that this is discussed as a possible cause and then managed. And so you treat the whole thing, the relationships, the work, all the school, all of that. So this is good. Now, my next question to you is this: what are lifestyle changes? Because our focus here is on kids. Obviously, you're a pediatrician. Are there lifestyle changes that can help my child with ADHD? Yes, we know medications, seeing their own pediatrician that can manage ADHD. What are lifestyle changes for a parent who is watching or a caregiver who's like, I'd like to really help my child?
Okay, so lifestyle changes would include, let's start from the very beginning, sleep. These kids that have ADHD actually need to have a good amount of sleep. So depending on the age of the child, if it's a toddler, we want the child to actually have 9 to 12 hours of sleep. If it's a school age kids, we want them to have about 9-ish hours of sleep. If it's a teenager, at the very least 8 hours. And because of how fast we live life, we actually don't factor those things in. A lot of times the kids are still running around playing until it's midnight before mom's like, oh my gosh, it's time, you need to go to sleep. Now, those kids who are sleep deprived are definitely going to be hyperactive and irritable in school the very next day. So if we start with sleep, so now let's go into morning time. Before the kid goes to school, breakfast is really important. And it's important because what the child eats makes a huge difference. So for instance, don't want to send the kids to school hyped on processed carbohydrates, because if the child is having like big sugar spikes, my background is so distracted. It's like I'm breaking up and coming back. I'm breaking up and coming back in. So if the child is really having like this big sugar spikes, because we fed them Fruit Loops, for instance. Fruit Loops is my perfect example. So Fruit Loops has processed sugars in it and also has dyes. So if the child is sensitive to the dyes and is now having sugar spikes on top of it, that child is going to, have problems at school the very next day. So that's the reason why. So my recommendation for breakfast would be a breakfast in low glycemic index foods, oatmeal, things that are slow processed, high in protein, so eggs and bacon, those kind of things would be my preferred advice for parents to feed their children before they go to school, rather than Pop-Tarts or Fruit Loops and stuff like that. So we've talked about food, we've talked about sleep. Then routines, coming up with very simple routines, things that the kids can remember to do. Like, for instance, a morning routine for a child with ADHD should be really simple, because they typically have difficulty getting up in the morning. And so you want them to get up and then know that they need to do maybe 5 things. For my patients, I tell them, you do 5 things when you get up. You get up, you use the bathroom, you wash your hands, you brush your teeth, you put on your clothes, and then you go look for your mom to say good morning and then get breakfast. But those 5 things you do before you talk to your mom. So, and then I make them count it. So, have you done all 5? If you haven't done all 5, then you're not ready to leave your room. So those kind of like simple routines that you put in place for them. And then routines are really good, because then those are things that you don't have to like remember, because one of the other big things about ADHD is that there is a deficit in the executive functioning. So I know I'm supposed to do 10 things, and my brain is unable to process what is the most important thing to do. But if you have those simple routines that they can learn and it becomes habits, then they don't have to remember. They don't have to think or try to prioritize what they need to do. Now, exercise. Exercise is huge. Exercise actually releases dopamine to the brain. So that's really huge. I really encourage all the kids, all the parents and kids to have their children get exercise earlier on in the day, not close to bedtime, but there should be a period of time for them to exercise. Now, let's see, screen time. Screen time is also a big thing. A lot of times, especially now, what I see now is that when I started PEDS a while ago, kids will come into the office with their books. And then what I'm seeing now is that kids are not coming in with books. Kids are not reading books. Parents are not it's almost like we've forgotten that reading is a big deal. So we have kids who are on their tablets all the way to bedtime. And then parents will tell me stuff like, well, the tablet puts them to sleep. And then I have to re-educate them that tablets don't put them to sleep. The light from tablets actually stimulates the brain to keep the kid awake. And so screens need to be put away. TV, devices, the phone, the iPad, and all of those things need to be put away at the very least 1 hour before bedtime so the kid can start to wind down. So I think those are
major. Those are major. And it's so interesting how this can also help adults. And a lot of the conversations that you're mentioning now, even with the habits or the routines, doing things over and over again, when you wake up, to automate it so you don't have to think so much about it. It becomes a habit. Really, really, really important. Now, my next question to you would be this: how can we, now we're home, so you have the routine at home, you have the breakfast, you have them sleeping, you limit screen time, but then they go off to school. How can we help them stay organized and focus at school outside of course, medications? How do you transition that to the school?
Okay, so my advice to parents is the very first thing, very first day of school, that you make friends with your teacher. The teacher has to become your very best friend. Okay. The other thing that I found is that, well, it might just be for the neighborhood and for the demographic that I take care of, that the parents are not quite as involved in their children as I would love for them to be. So the kids go to school. Sometimes they come home with homework and mom doesn't even know they have homework. So I always encourage my parents with children that have ADHD to actually make friends with the teacher, be in touch with the teacher, such that the teacher can send you a quick text to say, Johnny's not paying attention today. Johnny was really good yesterday. Okay. Johnny has homework that he hasn't brought in. Can you get him to bring it in? He might get some max docs, but he would at least get some credit on that. And so working closely with the teacher, making the teacher your friend is very, very important, because when the teacher is your friend and the teacher recognizes that you have invested in your child, then the teacher will reciprocate and be invested in your child for you.
That's very big. Go ahead. That's
sitting arrangements in class is huge. Yes. Okay. The children with ADHD should not be sitting in the back of the classroom. Should not be sitting by windows, because they'll be looking out the window and, oh, a bird just went by, and checking out everything that is happening outside the window instead of paying attention to what's going on in class. They will be distracted by the person walking past. So they shouldn't be sitting they shouldn't be sitting by the windows. They shouldn't be sitting by doorways. They shouldn't be sitting far away from the teacher. Second reason why they should be sitting really close to the teacher is so that teacher can redirect them in ways that is not obvious to the rest of the class. A hand on the shoulder, tapping on the table to say, hey, pay attention, get your work done, stop daydreaming. Or telling the child to get up and go across the room. When she realizes the child is restless, get up, walk across the room, go get me something from the other end of the room, just to give the child the opportunity to get up, walk around, and come back and sit down. Because children will get restless and fidgety once they get bored. And then the other thing is, to encourage teachers to also have, to incorporate into their classes a couple of minutes for the kids to stand up and shake. Stand up, shake your legs, shake your arms, move around. Yeah, move around, and then go back, sit down. And that breaks the monotony of the class and redirects that focus. So those are a few of the things that can be done in the classroom.
Awesome. These are so important. I'm getting a lot of tips here, and I'm sure my viewers who will watch live or in replay are also getting a lot of tips. Now, for the mom or the dad who's watching, who's like, the caregiver who's looking, who says, oh my goodness, ADHD sounds overwhelming. Are there resources that you typically recommend for parents to, because, when you Google stuff, it can be very overwhelming, but are there resources that you typically recommend for your, maybe for your clients or for people in general to go get, more educated or get more support groups when it comes to ADHD?
Yeah, there are two resources that I typically will refer patients to, and that's the CHAD, which is an acronym for the Child and Adult ADHD .org, chad.org, CHADD.org. And I also recommend that they read, there are lots and lots of really good articles in the Attitude Mag. It's called ADD ITUDE Mag. So those two places are the easiest places. Everywhere else, there's always, a lot of noise, a lot of noise, a lot of distortions. So, but these two places are definitely places that I know that they can go and they can register, and they can, like the Attitude Mag, they'll actually send you magazines, talking about what's going on, what's new in ADHD. And you can also do that online if you don't want the paper mags brought to your house. So it's the Attitude Mag and the chad.org.
Okay, and I put all that information here. That's really good. And, it's really important that we're having this conversation because, I'm thankful for Google access to a lot of information, but sometimes information overload, and you want guided research, and you want places where they're validated, where, they teach you what's possible, also things you can do, not just freak you out like, oh my God, your child has ADHD, it's the worst. It's not. It can actually be their superpower. So this is good. So, Doc, I have people who are watching who are like, I like this doctor. I like how she explains things. I like her tips, especially meeting with a teacher. That's my favorite. And having them strategically seated early on is very, very important. That's a big deal.
Yes.
But they're wondering, Doc, where can we find you? Maybe have you come speak on the platform or work with you. Where can we find you, Doc?
Okay, so I am on Instagram at Thrive with Dr. Grace at Instagram. I also started recently a YouTube channel, which is the same name, Thrive with Dr. Grace. And then I have a website, thrivewithdrgrace.com as well. So you can find me in all those places. And so you can also email me at thrivewithdrgrace@gmail.com. Those are so many.
But I like it that it's consistent. Thrive with Dr. Grace. Come and thrive with Dr. Grace. I love it. I like it too.
Thrive with Dr. Grace. The whole idea is to get everybody to, get the kids to thrive. It's not it seems overwhelming, but it isn't really difficult actually. If all the processes are simplified. So it's not that difficult.
Awesome. I like that you're giving hope. There's hope, guys. Ladies, women and men who are watching, there's hope. For your kids, they can live their best lives. We're empowering you. We're having these conversations to empower you to help your child thrive with ADHD. That's so interesting. In Thrive with Dr. Grace, you were meant for this topic. You were meant for this topic. I really appreciate you for coming on this Saturday morning to have a conversation with us. I've shared your information with our viewers so people can watch, and I thank you for doing this.
I am very appreciative for the opportunity to come and talk with your audience about ADHD. And I would love for anybody who had questions to reach out to me for answers, and I'll do my very best at answering your questions for you.
Awesome, awesome. You've heard her. You have her information, so reach out and watch. Her videos are very informative, so it'd be a good thing to also watch. And that being said, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician who will help empower you and have conversations like this to help you live long and well, that was a mouthful. I am she. Have a good Saturday, everyone. Thanks again.
You
Doctor.
too. Bye.